Temilade. I am consultant psychiatrist at the Lagos University Teaching Hospital, 𝐷𝐷, Lagos. As we all know, September is World Suicide Month. And today I would like to talk to you about the role of early intervention in prevention of suicide. Suicide is a global health challenge, and according to World Health Organization, it is said that every 40 seconds, somebody somewhere is committing suicide. In Nigeria alone, the prevalence is around 7.9 per 100,000 people, and in 2022 alone, in Nigeria, 79 cases were reported, 70 being males, with the remaining 9 being females. This does not include a lot of cases that were not reported. But before I go on to talk about the early intervention, let me quickly, intimate us with the signs and symptoms of depression being the commonest association with suicide. Many of the times, people feel overwhelmed and they may feel low in their spirits with associated loss of interest in pleasurable activities. They may have low energy. They may feel hopeless, helpless. They may be eating more or eating less. They may be sleeping more, or sometimes they totally lack sleep. They may have weepy spells and some other symptoms like that. Sometimes the associated suicidal ideation. Having said all of this, if all of these symptoms are present for a period of at least 2 weeks in an individual, they have met the criteria for a depressive disorder. Apart from this, sometimes depression is associated with suicidal ideation. And what are the red flags? The red flags are that, if you have a relative or a friend that is up and doing, that is always fun to be with, and all of a sudden they are socially withdrawn to themselves, they are not interested in anything around them, all of a sudden they become more talkative, or all of a sudden, they are happier than usual, or you notice a sudden change in their appetite or their sleep pattern, or their behavior generally. For most men, they may be drinking more, in order to stop their symptoms. When all of these are present, or sometimes people are trying to settle quarrels, or on occasions they may even post suicide notes. They may write it or they may post it on their social media. When all of these are present, they are strong indication of suicidal behavior. What are now the early intervention? As much as possible, the role of psychoeducation cannot be overemphasized. We're talking about psychoeducating the general public on common signs and symptoms of mental illness, on common signs and symptoms of depression itself, and early warning signs of suicidal behavior. Apart from this, apart from psychoeducating the general public, we're also trying to train our general practitioners, being the closest to the grassroots, on, recognizing early warning signs of suicide. We also want to screen all our clinic attendees for suicidal ideation. Apart from that, we're keeping follow-up of all recently discharged patients to ensure that they are well and they are fine. And then, apart from this, we also want to increase access to medical care. Many of the times, the psychiatric facilities are in the urban centers. We do not have so many psychiatrists available. But, apart from that, the other important intervention is, reduce access to means in at-risk individual. For example, availability of pesticides being the commonest, method or means of suicidal behavior in this part of the world. So all of these things put together, these are interventions. But I will also say that at the center, the Suicide Research and Prevention Initiative in Nigeria, SOPIN-NG, we are located at the Lagos University Teaching Hospital, 𝐷𝐷. At our center, we have our hotlines that people who are in distress can put a phone call through, and our staffs are there to talk to you, to allay your fears and to encourage you as much as possible. So these lines are available online. You can check them and you can put a phone call through either to yourself or to a friend or a relative. God bless you. Thank you for your time.